Okay guys, time to loosen up the ball and socket joint of the shoulders. So what do you need? Foam roller, which we've already done, stick, PVC pipe, broom, whatever you need. Let's get ready. All right, so this is just a good review. What we're gonna do here is tackle the thoracic spine. So he's getting his shoulders across his back, across his chest, moving that scapula out of the way.
Just hitting that thoracic spine, which we've already done before. So remember, before we tackle the shoulder joint, the ball and socket of actually the glenohumeral joint, you need to make sure that thoracic spine is moving correctly. If the thoracic spine's locked up, it's gonna really jack up the shoulder progression, okay? So that's why he's tackling this first. Hitting up and down, doing that 10 to 20 reps, kind of going to one side, kind of hitting isolation, doing thoracic spine extension. Now we're hitting that lat. So we're going from that armpit all the way down to the side, okay? So we've already kind of established this, but we wanna try to make sure we're not forgetting it. So remember, we have the MSA type of approach. Myofascial release, then we'll go through the stretches. Now he's tackling the pec. So remember, you're getting from the little pec minor area. So it's not just your pec major, you're going from that shoulder all the way into the mid part of the chest on one side. He has his thumb down, sitting there digging into that front shoulder a little bit too. There again, if you want to make it a little bit more, he can put it on the small of his back. Just dig into that front shoulder. Now remember, this is a little bit tender. Remember the rule, 10 passes back and forth. If it hurts a lot, 20.
So we did already the myofascial part. Now it's time, now the tissue's nice and loose. Here's the stretch part. So we're going to do what they call a sleeper stretch. So Doc's gonna lay on his side. He's gonna bring his arm either to an internal or external rotation. We're gonna tackle the internal rotation first. Now, just like we talked about in the hips, you need to work that internal and external rotation before you sit there and do the flexion extension. If not, it'll kind of have a little weird tension on the capsule itself inside the shoulder. So he's gonna try to go in as far as he can with the internal rotation, and he's gonna use his top hand to give him some resistance. He's gonna try to push back into his hand. You can do this like a gradual type tension, so you don't have to sit there and max effort every single time. It's a slow progression, because sometimes you will feel it really hard in this back shoulder. Take your time with this thing, ramp it up, and hold it for about 6 seconds, and then we're going to see if he can internally rotate a little bit more. Good. Try it again, rinse and repeat. Now, this will start to get some really big tension, especially the further down he gets. Breathe. Remember, your reset button is breathing. So once you get there, own that position, a few nice deep breaths, and let it calmly kind of bring that tension. If it's starting to cramp up, which it might happen, back off just a hair, breathe through it, see if that thing goes away, and try to see if you can go a little bit further. Your body's just fighting you for this because this is a really big stretch in that capsule. Now, we're gonna work on external rotation. Some of you guys actually might be pretty bad at this. You'll be stuck around here. Doc's pretty good about this one, okay? But all you do is the same concept. You would push forward, and then you would let it fall backwards. You can, if you want, kind of bring this other shoulder down, and sometimes that hand will start to pop up. Like we were saying, he works on his external rotation, so it's not a problem. So for you, if you are like Doc and you have really good shoulder extension, this is what we're gonna, or shoulder external rotation, here's the next progression. So here's where you get your trusty PVC pipe, broomstick, whatever you want. We're gonna start with the shoulder in a nice neutral position. It's like a 0-degree angle. So he's going to keep his elbow tucked and he's going to externally rotate. This hand is giving him like the assistance to kind of go all the way as far as he can. And then he is going to try to internally rotate, push with this hand, resist with this hand. Then he's gonna do the same thing, do it for a few seconds, keep that elbow nice and tucked. So what the tendency to happen here is this elbow will drift away from this side. Keep it nice and tucked, shoulder blades nice and engaged, and see if you can externally rotate. Once you get close to where he's at now, it starts to kind of be in a weird position because it's gonna start to slide off his hand right here in the palm. That's when we're going to go up a little bit more, almost to like a parallel to the ground, okay? So now we're switching the hand position so he can internally rotate, still the same position, but his arm's out to the side. So the pole's in his hand, the back part of the shoulder, and it's holding his hand with the opposite shoulder. He's going to externally rotate as far as he can. You can sit there and breathe, relax this bad boy, own the position. Once he feels like, hey, I'm okay, then now he's gonna, like he's almost arm wrestling. He's gonna arm wrestle, but he's holding this one tight. Try not to move that pole. Same thing, 6 seconds. See if he can kind of externally rotate even more, which he can. Now, tendency for this is to want to arch the back. So if you're starting to arch the back, nope, contract that core, keep that rib cage down, then all of a sudden, oh man, my shoulder external rotation is really not that good. That's okay, stop cheating, stop lying to yourself, own the position. Remember, you might cramp up, back off a little bit, take a nice deep breath, keep it going. All right, so now we're going to do We did internal rotation, external rotation. Now we're gonna do shoulder flexion. You can still keep the PVC pipe, thumb is up, and all he's gonna do is bend at the waist, doing almost like a hip hinge deadlift position, but you see how it's a lot of shoulder extension here. His spine is still in a good neutral position. You can even arch the back a little bit to get a little bit of an extension in the thoracic spine, since honestly a lot of people have this problem anyway. So he should get a big stretch through here and almost kind of like mimic the lat stretch we've already done. But still, we're gonna keep that principle the same. Spine is nice and stiff. He's gonna push that pole into the ground nice and hard. 6 seconds, breathe, let it extend even further. So you see how he got drastically more range of motion. That's gonna stay here for a second, nice deep breath. Push again, okay? So the concept of the pails and rails is pretty much the same. You get to your end range of motion, resist it, relax, see if you can have better range of motion, breathe so you can own that position. Okay, last but not least, you need a wall for this one. The only reason why is because your arm wants to kind of do funny things and kind of move around, so this is kind of help blocking in that system, or in that movement, so you can't cheat. So Doc's shoulders on the wall, his legs on the wall, his whole arm is pretty much on this wall, and he's gonna have the pole here close to his foot. We have it locked into a foam roller just so it doesn't move. He's in a half kneeling position, okay? What he's gonna do first is he's gonna bend a little bit at the hips, kind of keep his spine straight. He's gonna go up as little bit as he can. He's gonna grip that handle, keep it nice and tight, and then he's gonna sit up nice and tall. You will feel a major stretch on this front part of the shoulder, okay? So he's just holding that position, owning it, breathing. Then what he's gonna do is push the pole down into the ground again, and then he's gonna relax. Good. See if you can go up further. Grip it again. Every time you go up, it's a little bit more. Now, say you're like, oh, that was a bad idea, I went up too far. You can loosen your grip a little bit, and guess what? The tension of your shoulder will bring it back down a little. So that's okay. This is a good new movement. So remember that one where you internally rotate and try to touch that other shoulder? This is helping that initial beginning stages for you to actually have that movement pattern in the shoulder. So remember, breathe, a little bit of pain is okay. Cramping is okay. Your body is trying to fight against it because you're trying to open up the shoulder capsule. Enjoy.